Our last presenter is Patrick Lynch. He is an experienced biomedical manager with formal training as a technician, engineer, and in business management. He has worked exclusively in healthcare since 1975 and has managed clinical engineering and biomedical departments since 1979. Presently, he is with Global Medical Imaging, an ultrasound sales, training, parts, and service company in Charlotte, where his full-time job is to support the development of the biomedical profession throughout the country. This is accomplished through no-charge advice, consulting, frequent educational presentations, and the active creation and development of local biomedical professional associations. Professionally, he was the first president of the North Carolina Biomedical Association in 1980-81 and the chairman of the board of examiners for biomedical equipment and technicians for 6 years. Pat is presently a member of the Clinical Engineering Board of Examiners. Pat is married, living happily in Fort Mill, South Carolina with his wife, and near his 3 children and 4 grandchildren. Ladies and gentlemen, please welcome Mr. Pat Lynch.
Thank you very much. I realize this is the last session on the last day, so I'm going to try to make it good, upbeat, enlightening, and I'm going to say all I've got to say, and then I'm going to shut up and not necessarily drag it out to 5:15. I think that my introduction covered most of this, but let me just say in a way that I can connect with some of you in that the lady who was up here 2 speakers ago, Alicia Campbell, I was actually the director of clinical engineering at her hospital system 30 years ago in Charlotte. Carolinas Medical Center at that time was Charlotte Memorial Hospital. I was also at Northside Hospital in Atlanta. We have anybody from Georgia? Nobody. Wow. And I was with Premier, which is an ISO, which then became AHRA Clinical Technology Services. And also I managed a bunch of corporate biomeds at Trimedics, of which Baptist Hospital right behind us is a member of that. Problems back at the hospital. You know, we're all here because administration has come to us with various things like administration cut your budget. They won't let you hire new techs. They want you to do the same work with less people. They're asking you to cut out travel. How in the world can you do your job without the resources that you need? This is a presentation that I started and have given probably 50 times this year to clinical engineering societies across the United States, and a lot of the same things apply throughout the hospital. I'm going to tell you everything I know about the economic crisis. You, like me, probably feel about like in this picture here, that you're somewhere on the outer reaches of some unknown solar system, a speck of dust. There are forces going on that you don't understand, that you don't have any control over, you can't even conceive what the heck they are, and you're losing control of your own world. And that's the most frustrating part, is that you are losing control. This is everything I know about the healthcare industry today in the economic crisis, which is virtually nothing. If I said I knew something about it, I would say that I knew more than the heads of all these companies and the government and everything else, and in reality I don't. But we still need to deal with the results of that. It's very, very important. This is the result that the presentation, the report that Alicia Campbell talked about 2 talks ago, which was done in January of this year. It was a survey by the American Hospital Association. And one of the things they said they found out through this survey, and I assume you can still download it from the AHA website if you want to read it in its entirety. It's fairly brief and to the point. You know, this was groundbreaking news in January of this year. It isn't so much now, but that 9 out of 10 hospitals are finding it hard or impossible to access tax-exempt bonds, which is where they borrow money from primarily. They're also having trouble attracting charitable donations. And that she mentioned this, but 82% have canceled or put on hold their plans to upgrade their facility. 65% have put on hold or canceled their plans to acquire new clinical technology, which includes your area. and 62% have put on hold or canceled their plans to acquire or add or upgrade new information technology. This is the world that you and I live in. I live in the basement and service the equipment, and you live upstairs with the equipment, but we still are living in the same facility. These are the reasons that administration said that they were making these decisions and that they were cutting back. And I think that's very important because it gives us an insight into how administration thinks and the factors that cause them to make decisions. Too much.
We lost it completely. Where'd it go? I'm sorry.
Got that
I'm
one?
amazed I was getting anything done.
There's that one.
No wonder I didn't get some information. Let's put this right here. I'm sorry about that.
That's right. Do I have to start over? No. Thank God. But you've had a chance to look at these, and basically hospitals are faced with shortfalls of money, and they're having to stretch their budget and make things come together. And even though you as the radiology department have basically carried your hospital for years and years, I think it's a well-known fact that that radiology and the profits from radiology carry most of the loss leaders in the entire hospital. And that's kind of changing now. I want to talk to you about medical equipment service. That's the world I live in every single day. In hospitals, the medical equipment, 50% of the value of medical equipment lies in the radiology department. As your hospital, the biomedical engineering or clinical engineering or whatever you call it, consumes about 1% of the hospital's annual budget, operating budget. And the equipment that's in your area consumes about a half of that, so you're consuming or spending about 1/2 of 1% of the hospital's entire operating budget on the maintenance of your medical equipment. I'm a big proponent of having a professional service management team manage the service of medical equipment, including imaging equipment. Just so I know how hostile this audience is, how many of you already have an in-house clinical engineering department that is managing and overseeing the majority of your medical imaging equipment service? That's half. That's great. That's an unusually high number, I think. So the rest of you, have you found any of that to be very painful?